I'm Dr. Miriam Zachary. I am a sports medicine attending here at Mount Sinai, downtown Union Square. So the definition of a sprain is affecting one or more of the ligaments that give stability to our ankle joint. Depending on what grade of injury it is, which we can get into, is what exactly happened to those ligaments. So you can either have stretched those ligaments, so they're not giving as much stability as they should, and you can go as far as tearing these ligaments as well. There are different mechanisms that we can get into of which an ankle sprain can occur. And depending on the mechanism, we look for the different ligaments that attach to the different bones to see which is affected and what we can do to rehab it. Rolling our ankle, that's basically what all of us know an ankle sprain to be. So things that can cause us to roll our ankle, put us more at risk for it is, of course, if we're involved in any sports that involve running and change in direction. Also walking on uneven surfaces, which us here in New York City know very well out on our sidewalks and in the street. Misstepping can cause you to roll your ankle as well. And all of this, or any mechanism that can put you at risk of rolling your ankle or having an unstable situation in your ankle, can cause an ankle sprain. So it all depends. You need to be assessed usually by a physician if it is severe and you're unable to bear weight onto the ankle. But if you roll your ankle, you're kind of able to shake it off and walk on it. You would, if you appreciate any swelling, you want to make sure you're elevating your ankle. You want to make sure you're applying ice to your ankle. And I always recommend 20 minutes on, 20 minutes off for at least the first 48 hours, but continue icing it until full recovery, which also we could get into. And if you have any instability in the ankle, you can use a brace to help, and always add compression to help with the swelling in the ankle. Of course, being evaluated by a sports medicine physician or your family medicine physician, if you have any questions, is the way to go. They can give you more advice. They can assess you to see if there's any reason to get more imaging, or if there's anything more that you need to do. You could also take over-the-counter pain meds if the pain is hard to bear, and anti-inflammatories seem to do the trick for ankle sprains. So every ankle sprain is treated differently. Not all ankle sprains are created equally. So we'd have to assess how you feel walking on your ankle. A lot of grade 1 sprains, people are able to tolerate walking on their ankle. What is a grade 1 sprain? That is when you have no tears in ligaments, but you just have stretching of the ligament after rolling your ankle or spraining it. Grade 2 sprains indicate that there's a partial tear in one of the ligaments in the ankle and stretching of others. Grade 3 is when you have full tear of one or more of the ligaments in your ankle. Grade 2 and 3, sometimes it is difficult to bear weight, and we really just assess how long it'll take you to be back on your feet based on your pain level. So if it hurts to walk on it initially, we give you crutches, we can give you a walking boot, or in more severe cases, a wheelchair for people who don't have the ability to use crutches. And we gradually try to return you to weight bearing. So it's something we call weight bearing as tolerated. So we see and test your tolerance and see how the pain is, kind of serial exams. And when it doesn't hurt to walk, you're back on your feet. So with grade 2, we've seen that 2 to 3 weeks non-weight bearing. And with grade 3, we've seen sometimes it go up to 1 to 2 months of non-weight bearing and being immobilized for those, just because you have the full tears and you do lose stability in the ankle as well. So it's not just pain that's an issue at grade 3, but also stability. Not to say that we don't see stability issues with grade 1 and 2, but less so. So it really is dependent on the patient and on the athlete of when they can be back on their feet. And we always say respect the pain, so you're able to do activities that are pain-free. But once you do an activity and it re-exacerbates your pain, that's your body's way of telling you that you might be making the condition worse. So the sooner you see a physician, the better. It's always good to be assessed to see, do you have a grade 1 sprain or grade 2, grade 3? And you'll get advice on how to rehab it, what things can help with your pain, what we can do to reduce the inflammation in your ankle, and also to be assessed to see if you need further imaging. So there are a few signs that we look at as physicians that indicate maybe we should get an x-ray to make sure that this injury didn't cause a fracture as well. So, if you have any pain over the bones of the feet and the ankles, if you're unable to walk on it, even take 1 or 2 steps, these are all signs that you probably need further imaging, and you would have to see a physician to have that ordered. So that's a great question. it goes on the fact that when we sprain our ankle, like I had mentioned, we do stretch our ligaments. Once the ligaments are stretched, they don't really come back and tighten up again. They're stretched for the rest of our life. So what can happen, yes, scar tissue can build and kind of give us some stability, but we have chronic ankle instability. So we're constantly injuring our ankle. How do we make up for that? We would work on the muscles surrounding our ankle to give that stability back to our ankle. We can't strengthen our ligaments, but we can strengthen what we call our secondary stabilizers, which is our muscles around the ankle. By doing that, you're almost forming an innate ankle brace by strengthening the muscles around it. However, in the acute phase, so if you've just rolled your ankle and you have some swelling and instability, using a lace-up brace is not a bad idea. A lot of our athletes that do have chronic instability, we also, while they perform, we do some taping to help with the stability and pain as well. But overall, I think that the definitive treatment for chronic instability is working on those muscles to keep your ankle stable and to make up for the sprain that we had earlier on in our life. Yes, absolutely. So just like I had said, of course, we can't strengthen our ligaments. They're static structures. They don't move, so we can't work them out. What we can do is we can work out the muscles around our ankle, both on the outside of our ankle and on the inside, and the intrinsic muscles in our feet. So on the outside of our ankle, some of the muscles start running as high as our knee. So if you go to physical therapy, work with a trainer, they'll start working on some lower leg muscles, but these muscles actually cross the ankle joint and give it stability. It is intense. So for all 4 years preparing to leading up to the Olympics, right? So we know there's 4 years between each Olympic Games. They are constantly traveling internationally, nationally to compete in qualifying events. So just preparing for that in itself is brutal. But the year leading up, and especially in this very unique year with COVID, it is daily practices. They're cross training and doing strength and conditioning as well with strength and conditioning coaches. They're constantly seen by our physical therapists, chiropractors, everyone getting the adjustment they need, and also working on strengthening those really important muscles that we spoke about for instability of any of the joints. So leading up to the year leading up is definitely much more intense than the others, but it's 4 long years of preparing for competition, competing, training, recovering from that competition and getting ready for the next one. So interestingly enough, we see a lot of ankle injuries, especially when we're on the strip with them while they're fencing. A lot of them roll their ankle because they are lunging forward and they can roll their ankle doing so, or as they're retreating backwards. Same thing, they're at risk of spraining their ankle. Going on the fact that they do lunge forward pretty aggressively, we see a lot of hip injuries as well. And the hip injuries involve everything from the labrum in the hip to the muscles surrounding the hip, most specifically the hip adductors, so they're the muscles on the inside of the thigh, and the hip flexors, which are in the front of the hip and help in hip flexion. We also see upper extremity injuries, and those are more from impact as they're holding their weapon and they have bell guard to bell guard contact. A lot of impact goes through their fingers and their wrists. And if someone misses and hits their ungloved hand as well with their weapon, we do see injuries there. And it can range anything from a superficial cut to fracture or tendinous injury in that hand. So this year was a very, very unique year in our relationship, given that COVID had changed the world of sports medicine. So we have been involved in keeping these athletes safe by sitting in on meetings to talk about protocols for masking, protocols for testing prior to travel, prior to competition, or at competition, talking about protocols for in-competition sanitizing. And as the physicians on the team, everyone really relied on us to come up with these protocols. Other things involve when they had exposure incidents. We did all the contact tracing, we did the testing, we did the cardiac clearance, or worked with our cardiologist to get them clearance after being diagnosed with COVID. Because as we know, some people had cardiac sequelae following, and these elite athletes really stress their heart more than, the rest of the population. So it's that much more important to make sure their heart is ready to take that load. And we've a lot of our athletes did experience some post-acute COVID symptoms, and we rehabbed them through it, and we got them back fencing slowly through it, and which was extremely rewarding. But aside from that, of course, every other year in our career had its challenges as well, where we're working with these acute injuries and saying, what can we do right here and right now to get you back on the strip, to get you to Tokyo and be able to fence? And then, the later long-term rehab when you get back to really fix the problem and address what's going on. So definitely multifaceted, and it's all around been very rewarding. So we are privileged to have what I would think some of the coolest Olympic athletes. They're really great, very down to earth, at least the ones that we work with. It's motivating. So they're determined. They will do anything that we ask of them to get better and to get them back on the strip. They are very, very disciplined. So we see that with their rehab as well. And I would say the most rewarding thing is working with them and getting them to Tokyo and then sitting back and watching them compete and do well and bring home some hardware. So it's really cool. I think it definitely is one of the most rewarding things I've done in my career. Hopefully more to come, but it's definitely a great experience. It's great to work with such a disciplined, motivated group, and it's great to see them succeed.